Welcome to Healthcare Matters, where the medical and legal communities come together to discuss healthcare matters. I'm your host, Mike Matray, and today's guest is John Degnan. He is a shareholder at BRIGGS MORGAN in Minneapolis, where he regularly represents clients in business disputes, as well as members of the legal and medical communities in professional matters. He has more than 39 years of experience handling medical malpractice claims, prescription drug and pharmacy matters, products liability, and issues relating to EMTALA and the Federal False Claims Act. This is Mr. Degnan's second appearance on Healthcare Matters. Welcome back, John.
Thank you. Glad to be here again.
Well, why don't we start? A relatively recent phenomenon in healthcare delivery has been the expanding availability of healthcare in America's big box retail stores. CVS recently purchased Target's in-store health clinics, making it the largest provider of healthcare via retail outlets. How do liability risks differ within these big box retailers as opposed to a doctor's office? And how would you recommend these new healthcare delivery sites mitigate the risks?
Well, I first think that it's a real good benefit for our people to be able to come to such like minute clinics, etc. But providers should keep in mind that it doesn't change the standard of care. It's basically the same standard of care as it would be for primary care doctors or specifically for an urgent care center. And I think that the real tension is between the efficiency factor, because they'll see so many people, but at the same time the need to completely document the care. And that includes particularly good discharge instruction handouts on follow-up care that's needed, and even more important, if there's a necessary referral, to make sure that it's a clear referral for further care.
That's my understanding. I've been told that it's basically evidence-based healthcare, and that the biggest liability would be if there wasn't a referral, if a more pressing healthcare issue was discovered.
Yes, and the danger with the duty to refer is this. If there is a need to refer and it's not done, then that provider could be held to the same standard of care as that specialist. So if it's a cardiologist that should have been getting a referral, they well could have a cardiologist express standard of care issues if there was a duty to refer. So it's particularly important for providers to keep in mind.
Excellent. Well, thank you for coming on Healthcare Matters again, John, and I hope to see you again soon.
Thank you very much. Appreciate it.
In your professional experience, do higher limits on a physician's medical professional liability insurance policy increase the dollar value in the case of settlements when you have an indefensible claim? In other words, can your physician or entity be overinsured? And conversely, can a case be made that the lower the limit, the lower the risk exposure?